Howdy folks, it's Dr. Z returning for VEDA2014 to do one last scheduled topic about pharmacy on day 27. So far, I've enjoyed talking about my experiences in pharmacy, and even had a chance to tie my experiences to something more current like my switch in jobs. Now I want to talk about what I feel will be the future of pharmacy. A lot of people will have positives and negatives when it comes to the future of American healthcare, but I feel that wherever it may go, pharmacy will always be there to take up the opportunity to help. That can already be seen by the decrease in the general practitioners in medicine, leading to an increase in clinical role of pharmacists in treatment and monitoring of our patients. Generally, my class and classes after me in pharmacy school have been trained to take up these opportunities and run with them, to not only increase the access patients will have to healthcare system, but to grow beyond our traditional dispensing duties. Personally, I view the future as hopeful, given that with the ACA, aka Obamacare, there will be a need for documenting outcomes while patients are at home rather than at an office or in a hospital. I practiced with many pharmacists during my last year in pharmacy school who do just that, and I feel that that role may increase as time moves on, but only with the cooperation with the American Medical Association, or AMA, which isn't exactly friendly to the increased role in pharmacists. As long as we can find common ground or be able to work together, I only feel that this is going to benefit the patient in the long run. However, one of the major downsides I see in our future is the decreased reimbursement rates from insurance companies as well as through Medicare and Medicaid. When I was with Walgreens, I was basically sheltered from this reality, given that all this data and all this worry was given to other departments that drafted up the contracts and worked out these disputes on behalf of the company. After only being with an independent pharmacy for just 2 weeks, I now realize how much of an impact reimbursement rates can have to allow a pharmacy to survive. What we charge to not only dispense the medications, but also to review their charts and also counsel them on their medications are almost never paid by any of those with insurance, other than those who are just paying cash or paying for the medication itself. And these insurance companies almost always end up paying for the cost of the medications based on guidelines that will always lead to a loss on the pharmacy's end. And that's why I feel that these ancillary services before, such as medication therapy management, immunizations, compounding, as well as many, many more things, have to become less of a novelty and more of an ingrained daily role of a community pharmacist in order for us to survive. Again, it all leads back to that patient. We may not be paid for our traditional role anymore, so we have to adapt and provide for our future, all of which will benefit the patients in the end. So that's a quick take on my future of pharmacy. Thank you for watching. Tomorrow I'll do my last viewer special. I've yet to receive many comments or questions that anyone wants me to answer, but I'm still hopeful, so please send them on. I'd be more than happy to answer them. Like and share my videos, subscribe to my channel. I've been Dr. Z, now signing out, and I'll see you tomorrow.